The Sine Institute of Policy and Politics is American University's incubator for policy innovation. We convene leaders in the academic, public, private, nonprofit, and journalism sectors to engage and promote common ground and nonpartisan solutions. In an evolving world, we seize the opportunity to work on the nation's most pressing challenges through collaboration by experts and top scholars in their field with students in research and scholarship. As part of that goal, the Sine Institute leverages American University's location in our nation's capital, the nexus of government and a growing international business center. We connect diverse perspectives from around the country and around the world with our world-class academics and research, experienced practitioners, and the most politically active student body in the U.S. We stand apart through our focus on the role of business and the nonprofit community in public policy, the rise of the importance of economic regions in the United States, and international policy issues. Our focus is to make an immediate impact at the intersection of policy and politics that leads to real and lasting change. Thank you for joining us as we convene, communicate, and collaborate. Reimagining America, Our Health, with your moderator, Danielle Gray, Sine Institute Advisory Board member and Senior Vice President and Administrative Officer for Blue Cross Blue Shield of North Carolina.
Thank you, Amy, for that introduction. As Amy just said, I'm Danielle Gray. I'm a board member, proud board member of the Sine Institute at American University. And I'm currently the Chief Legal and Administrative Officer for Blue Cross Blue Shield of North Carolina. We are delighted to have you all here today to join us as part of our Reimagining America Summer series. And today we're going to be discussing the impacts of the COVID-19 pandemic. I want to start by thanking our sponsors. So the Health Law and Policy Program at American University's Washington College of Law is one of our co-sponsors today. In addition, the Center for Health Risk and Society at the College of Arts and Sciences has also joined as a co-sponsor today. So thank you to them both. We are really honored and fortunate to have with us today Dr. Rachel Levine. I can't think of a better expert to discuss these issues with you all today. Dr. Levine serves as Assistant Secretary for Health at the Department of Health and Human Services. And she's working every day to help our nation overcome this pandemic and to build a stronger foundation for a healthier future. You all have seen her bio and her impressive background and experiences, which highlights why she's such a great person to talk to about the public health challenges we're facing today. A distinguished career in academic medicine, as a practicing physician, as a public health official in the state of Pennsylvania, first as Physician General, and then as Pennsylvania's Secretary of Health. And throughout all of those experiences, a particular focus around the intersection of mental health and physical health, which I hope we'll get into in the conversation today, but also treating some of our youngest citizens, children and adolescents in particular. So we're excited for this conversation today. Just a housekeeping note, you all have the ability to ask questions. I will try to monitor the Q&A function and weave those throughout the discussion. And I think we're going to also leave a little bit of time at the end. So Dr. Levine, welcome. And I'll just start by encouraging us all to step back a little bit. This has obviously been a challenging year and a half, maybe more, for communities all across the world. And we're so focused on our day-to-day of survival. Sometimes it's helpful just to take a step back and think about the larger overall impact of the pandemic on global health. And so thought maybe you could just get us started with some of your thoughts there.
Well, thank you so much for having me here today. It's very exciting to be with you. I'm especially excited to be talking to young people, the next generation of leaders in our nation and globally. So I hope that at the end of the talk, you all can feel energized and excited about the future. I know I do. But we are in the midst of the largest pandemic that has impacted the world in the last 102 years. And I think it's important for us to understand some of the lessons of the pandemic, to take a step back, as you said, and think of some of the lessons. COVID-19 has certainly underscored how we are all interconnected. That what happens in one corner of the world does not stay isolated. It really impacts the rest of the world. And of course, that's true in our nation as well. So, it makes it even more important for us to work together, not only to advance our own health, but really to advance everyone's health across our nation and across the world. The pandemic, I think, has broken down barriers. I think it has worked to foster international collaboration. I think we need to continue to do that. It really is a global community united behind a common cause. And we all need to strive to work together to work through and past this terrible pandemic. Another important lesson is the profound importance of public health. And it is just so important that we ensure that local, state, national, and international public health authorities have the resources, have the workforce, have the data and IT capabilities that are needed to protect the health of our nation and the world as we move forward. But there are areas that we have to do better on. There are areas that we have to do better on. We have to do better and continue to strive to do better in terms of that collaboration within our nation and internationally. We have to emphasize and work on health equity, which I'm sure we'll be talking about as we proceed, and also issues of mental health and addiction and substance use disorders. So all things that we need to continue to work on.
Thank you. And maybe we'll pick up at your last point on health equity. I think the pandemic has obviously exposed and in some ways exacerbated some of the inequities that exist with some of our more vulnerable populations and communities. And if you could just share some of your thoughts on some of these divides and how they really came to light over the last year and a half.
Well, thank you for that question. I think it's a very important point. I mean, certainly COVID-19 has impacted some communities far more than it has impacted other communities. And I think that it has shown the iceberg that was beneath the surface in terms of health disparities across our nation, and certainly health disparities globally. The health of racial and ethnic minority groups and economically disadvantaged persons and communities have been disproportionately impacted by the pandemic. These communities remain at higher risk for COVID-19 infection, for severe infection by COVID-19, from increased psychological and mental health stress due to the pandemic, and tragically increased risk of death. I'll give you some examples. Nearly 90% of disproportionately Black counties have reported a COVID-19 case, and 49% of those counties have reported a death versus 81% and 28% for other counties. We also have seen increased risks of depression in Hispanic adults. And there's lots of statistics to show these health disparities in COVID-19, but also the health disparities that exist for many, many conditions throughout our nation. So that is actually one of our goals and one of our priorities. It's a priority for the president, for the secretary, for myself, and across HHS to be able to deal with this issue of health equity and health disparities that exist in our nation.
That's great to hear. And I know the administration has made thinking about in a very targeted way some of the unique access and equity hurdles that confront communities of color, the LGBTQ community, economically vulnerable communities, and having actual targeted strategies towards making sure that those communities are getting access to the vaccine, access to treatments and the like. I was hoping you might talk about some of those efforts that you might want to highlight with any of those communities.
Thank you. Well, yes, addressing these health disparities is key to our mission. It is also, even more generally, key to the recovery of our nation and the resilience of our nation going forward in the wake of COVID-19. So we're approaching a comprehensive approach to health equity for all. As I said, it's a priority of the president and the administration, as well as the secretary. One thing that has been done is the creation of the COVID-19 Health Equity Task Force. They have finished their basic public meetings. We're now working on honing those recommendations specifically to the president on how to mitigate the health inequities caused by or exacerbated by COVID-19 and how to prevent those inequities in the future. We also have a health disparities council that the secretary has started at the Department of Health and Human Services. I'm very pleased to have a seat on the COVID-19 Health Equity Task Force and to co-chair the Health Disparities Council. We're going to be working on all different aspects with all of the different divisions within HHS on these specific issues. On a couple of specific things, we've worked to make healthcare more affordable with the special enrollment period in the ACA. That actually continues through August 15th so that people can get the health coverage that they need. So they can actually go on healthcare.gov and to be able to access the special enrollment period for another 11 days to be able to do that. We're looking to address the mental health that we mentioned and behavioral health impacts and the substance use impacts. And we're doing this through another council, the Behavioral Health Coordinating Council, which I also co-chair with the Assistant Secretary for Mental Health and Substance Use. So we're going to be looking at collaborative and innovative and taking an equitable approach to addressing our behavioral health agenda. We need to make sure that these issues of health equity include sexual and gender minorities. It includes the LGBTQ+ community. And we've already taken an action through the Office of Civil Rights to do that in terms of its interpretation of Section 1557 of the Affordable Care Act, that when the Affordable Care Act says that you cannot discriminate on the basis of sex, that includes sexual orientation and gender identity, and we're working to extend that across all of our interpretations of the ACA. We ought to pay some particular attention to groups within, particularly vulnerable groups within the LGBTQ+ community. One are transgender youth. Transgender youth have a high risk of being bullied or harassed in schools in their community. But they're at particular risk now because of very challenging and difficult laws that have been passed by a number of different states. And so we need to really work to protect and nurture transgender youth, not pass laws that limit their ability to participate in activities and the most egregious laws which prohibit their ability to access gender affirming care in their states. Another LGBTQ+ group are LGBTQ+ individuals, particularly transgender individuals of color, who are not just at risk of discrimination or harassment, but they are at risk of violence and even murder and deserve our particular attention and protection. So, we have so many different issues to work on. We need to work on these health disparities for the African American community, for the Latinx community, for the American Indian Native American community. So many things to work on. And we're working to establish that trust at a community level. We want to listen to people's concerns. We want to work with their individual communities. And we have a long way to go, but I'm a positive and optimistic person, and I'm confident that we will get there.
Excellent. Shifting gears a bit, one thing that has been striking about this pandemic is there were probably some reforms in healthcare that we've been grappling with as a policy matter that were accelerated during the crisis. And I think of telehealth as an example. And I say that as someone who works at a payer. And so we've had to quickly adjust and get up to speed with this new norm. What do you think some of the more impactful emergency changes that we've made in our healthcare system during this time that might survive even after this period?
Sure. Well, certainly the emergency continues, right? So the public health emergency continues. The struggle against COVID-19 continues. It is critically important that we not be complacent and especially with the spread of the more transmissible Delta variant. We're still in the midst of this fight. But you're right, there are some emergency measures that should continue. Some have been put into place to make it easier to respond to the public health crisis. Those include economic safeguards and research and telehealth, as you mentioned. So what are some of the ones that should be kept? And I'm just brainstorming here. I mean, I think that it is important to adapt research to make it more nimble. And that includes proposing and reviewing changes to studies. And so, those expedited review procedures might continue for these type of issues. I think HIPAA flexibility for telehealth technology. There is more flexibility now to using technology for virtual visits. Some specific Medicare and Medicaid policies, federal COVID-19 waivers and regulatory changes make it easier for providers to deliver those telehealth services that you mentioned to Medicare and Medicaid patients. Telehealth licensing requirements, interstate compacts is a big issue. Having the ability for providers to deliver telehealth services across state lines, and that might depend upon the rules and laws that are set by states and federal policies. Prescribing controlled substances during the COVID-19 public health emergency. Authorized providers could prescribe controlled substances via a telehealth without the need for in-person medical evaluation. One of the key things that we've done is to allow providers to prescribe controlled substances such as buprenorphine medications by telehealth, which I think is critical to treat individuals suffering from the disease of opioid addiction. Telehealth reimbursement in terms of insurance payers and healthcare professional associations have supported the transition to telehealth services. CMS has issued waivers providing flexibility. So I think that it is critical that we continue those flexibilities. So, I think that those are just some of the issues that we need, and I'm sure that there's more that we'll need to look at to continue after the COVID-19 emergency is over, particularly in terms of telehealth, which I think is part of the fabric of our healthcare system now, and we don't want to go back.
Yeah, I had a telehealth visit this morning, so I can attest to that. Another area that I think that I've observed where we've sort of changed our philosophy, and particularly at the state level, is thinking about access to transportation and how important that is for access to healthcare. And so here in North Carolina, I know our state plan put a lot of thought into thinking about and partnering with the Lyfts and the Ubers of the world on getting people to vaccination sites. I know there's been a number of conversations about this at the federal level as well. Can you just talk a little bit about that? I think sometimes people don't think about transportation or housing or some of these issues as healthcare, but they obviously very much are drivers of healthcare. And so if you could just speak a little bit about that would be great.
I think it's a very interesting point. The Biden-Harris administration has taken a whole of government approach that was just really impressive. Engaged those facets of government that you mentioned that we don't usually think of in terms of health, and that includes the Department of Transportation. I like to think of it as part of what we call the social determinants of health. There are many aspects of health that we don't traditionally think of, and we want to include health in all policies, including transportation policies. Other things that we might think of, though, in our housing, I think is health. I think that education from that perspective is health. Of course, the environment is health. Many different aspects when we think of those social determinants of health. The safety of our transportation networks is really vital to maintaining, of course, economic durability and the flow of essential supplies and food and fuel, but also the supply of medical equipment. That supply system. The supply system for medicines, for laboratory testing materials, I think the supply chain has shown to be absolutely critical in terms of maintaining our healthcare system. We also want to, as you mentioned, we've partnered with Uber and Lyft and others in terms of providing free rides for people to get vaccinated. And we want to continue that. So, access to healthcare, access to seeing a doctor is a major block for many underserved communities. That can be in urban areas, suburban areas, and particularly an issue in terms of rural areas. And so I think we can address that one through telehealth, but the other is through these ride sharing apps and support and coverage for those rides. So we need to decrease and address any access limitations that we see for underserved communities really throughout the United States. And so we're going to continue to look at what works, what doesn't work, and we'll implement the measures that work for us and to continue to those. But I do want to emphasize the broader social issues that determine people's health.
Excellent. We have a couple of questions in the Q&A that I'm going to raise. And I think they both speak to a point you made earlier, which is that we're still in the public health emergency. The crisis continues. So one question we have in the Q&A is around children under the age of 12. So this is a population that still has not been vaccinated. They are returning to school next week, in a couple of weeks. And the Delta variant is obviously quite prevalent. And so the questioner asks, what do you see for them? Masking, reduced sports, and the commenter notes that, obviously we're seeing a lot of reports about the Delta variant and children testing positive. So any light you can shed on how we should think about this population, particularly with the return to school?
Sure. There are 3 public health tools in our toolbox as we address the pandemic. The first is containment, to contain the spread and to contain outbreaks. We do that by testing. So we'll certainly want to have expanded testing capability. States will and local health departments to initiate testing in schools and for young people, and then contact tracing with appropriate isolation and quarantine. The second tool is mitigation, and that includes mask wearing. And so the CDC has recommended that young people in K through 12 and staff and teachers wear masks when in school. And the American Academy of Pediatrics, of which I've been a proud fellow for probably more years than I want to say on this program, more decades, recommends that the students, the young people, the teachers, the staff wear masks no matter their vaccination status. So that mitigation measure is very important. And the third is medical countermeasures, and that in this context means vaccines. Our vaccines are safe. They are effective. We know that they're safe. Almost 350 million vaccines have been given in the United States and countless millions more nationally and internationally. So we really want to, and they are effective, and they're effective against the Delta variant. So we want to emphasize the safe, effective vaccines. We want to get past people's vaccine concerns and hesitancy, answer their questions. And really the safest way that our children can get back to school is to have more and more people vaccinated, particularly in communities and states that currently have lower vaccination rates. And that is the biggest thing we can do to ensure that our children are safe as they go back to school. And so, for people who are vaccine hesitant, if you're not sure you want to do it for yourself, then really do it for your children. Do it for your communities and for children to get back to school and for our nation.
Thank you. I'm struck listening to you. You've obviously spent so much of your career thinking about the health of children, and I think one thing all of us who have observed children during this pandemic have thought about is just what are the long-term impacts going to be on our kids? How are they doing through this? Not just physically, but also mentally, emotionally, being disconnected from school and having to do virtual school for long periods. If you could just speak a little bit about just sort of how do we think about how the kids are doing, and are there things that we should be thinking about more long-term about making sure that they're on a sustainable and healthy path going forward coming out of this?
Mm-hmm. There are many aspects of this, but you're right. I'm a pediatrician by my initial training and an adolescent medicine subspecialist, and spent many years in academic medicine, at Mount Sinai in New York City, and then the last 20 or more years at Penn State at College of Medicine in Hershey, Pennsylvania, treating children and adolescents. And really, one of the things that I emphasized in my career was that intersection between physical health and mental health, between traditional medical issues and mental health and behavioral health issues. For example, I saw many young people with eating disorders, such as anorexia nervosa, bulimia nervosa, and other conditions as well. And so I think we'll need to look at the physical health and the mental health. From a physical health point of view, again, the COVID-19 pandemic is not over. And we have safe and effective vaccine, the Pfizer vaccine, for teens, 12 through 17, of course, adults 18 and older. And so we really, really want to emphasize before school is that those young people, 12 through 17, get immunized. There are clinical trials going on right now with the Pfizer and Moderna vaccines, and I believe, if not now, soon with the Johnson & Johnson vaccine for children actually 6 months through 5 years of age, and then 5 and 6 years of age through 12 years of age. And so hopefully, can't tell you when, can't put a date on science, we'll have safe and effective vaccines for them. But we need to take into consideration their physical health. Their mental health has to be considered as well, and the impacts of the COVID-19 pandemic on the mental health of our children, the mental health of the necessary mitigation measures that we put in place last year, the school closures, et cetera. And so, we're going to need to pay extra attention to their mental health. And so with our Behavioral Health Coordinating Council, we have a specific subcommittee looking at children and their mental health. And we also have a specific subcommittee looking at that integration of physical health and mental health. So I think that one of the first stops for parents, if they're concerned about mental health of their children, will be their primary care provider. And so that gets into that integration that we talked about into the telehealth services that we talked about. Telemental health, I think, will be a very important vehicle. One thing that was put into place in Pennsylvania at Penn State was actually a program called Project Echo. This is building upon a program developed in New Mexico, where subspecialists, for instance, child and adolescent psychiatrists, can then work with pediatricians and family physicians in the community to help with cases, to work with telehealth in terms of these mental health issues for children. I think that we'll need to pay particular attention to the mental health issues in schools. And so it highlights the importance of school counselors and school referrals and the student assistance programs, looking at mental health in children. So I think it's going to need to be looking at both.
Thank you. We have a couple of questions in the chat that speak to something you mentioned earlier, which is vaccine hesitancy. And so one commenter raised a question around what do we do with people who are skeptical of the science or the safety and are not sure? We all have family members, friends in this position. What should we be saying to them? What should our message be to them? And another commenter says that he's worried about the safety for his child who's under the age of 12 of the vaccines. And so I wonder if you could just speak generally, because I think this is something I suspect a lot of us are dealing with in our day-to-day lives, and what should we be saying in these cases?
Mm-hmm. I think that we want to address people's hesitancy with information, with facts, with information from public health authorities, federal public health authorities such as myself, Dr. Fauci, Dr. Walensky, Dr. Murthy, our Surgeon General, and others, but also state and local public health officials. Not so long ago, I was the Secretary of Health of Pennsylvania and had almost a daily press conference about the COVID-19 pandemic, trying to talk about the public health issues, and then, but right before I left, our safe and effective vaccines. We also want to work with trusted community leaders, our coronavirus community core, to talk to their community. So these would be local officials, local faith leaders, and others who community members might know personally, or know of them much more than they might, us on TV, so that they trust their recommendations and their advice. We want to reassure people, again, about the safety of the vaccines. They have been through, clinical trials and safety testing. The Pfizer and Moderna vaccines are being considered for their full FDA approval. And when all that information is digested, we are hopeful and confident about their full approval, but that process has to go through. Then the Johnson & Johnson vaccine after that. 350 million vaccines have been given in the United States with an excellent safety profile, as well as, again, countless millions more given internationally, that we know that they are effective and that they are effective against the Delta variant. So we do want people to have faith in science. We also want to the best of our ability, make sure that this issue of the vaccines, but also really the public health response to COVID-19 is not politicized. These are not political issues. These are medical and public health issues. And so we want to work past the politicalization of this process. And then finally, the Surgeon General has put out a specific advisory looking to counter misinformation and disinformation, particularly that on social media. And so I would take a look at the Surgeon General's website about sort of how to analyze, particularly social media, but other media for the facts and the scientific veracity, the scientific truth of what people are saying. So we want to emphasize the true information, the scientific information, and then combat misinformation.
Thank you. Yeah, I was going to ask about the flip side of getting correct and truthful information, which is sort of how do we deal with incorrect information? Because for every press conference that you do or that Dr. Fauci does or expert, in a post on social media that is reposted 3 million times can really undo that. And so how are we thinking about dealing with that in the future? Because that is such a powerful medium.
The other thing I'd like to mention is that some people find it confusing that at times our recommendations have changed. And I guess what I'd like to emphasize is several points. One is that this is a novel coronavirus. You heard that in 2020. That means it was new. The world had never seen it before. Public health had never seen this coronavirus before, and the medical community had never seen it before. So we have been learning as we go. We have learned so much in the last year and a half, but there is a process to that. And that is really the medical and scientific method, is to learn from what we're seeing clinically in patients, and to learn from science and scientific investigations, and then to apply that to medical practice and to apply that to public health. And I'll give you an example. The coronavirus has changed. There have been several variants that have developed of COVID-19. The first was the original COVID-19, but then we saw many other variants develop. For instance, the Alpha variant, Alpha, Beta, Delta, those are from the Greek alphabet. It's just how we're naming them. And that was more contagious, and we saw that spread in various countries throughout the world and the United States. And now what we're seeing is what is called the Delta variant. And this variant is more contagious. It's really essentially as contagious as chickenpox, which is very contagious. It is more transmissible. It is potentially leading to more severe disease and more hospitalizations. And so, of course, with this new variant of the coronavirus, our medical approach has changed and our public health approach has changed, and the recommendations have changed. We need to be clear, but we also need to be nimble and adapt our communication and our recommendations according to what we're seeing on the ground.
Thank you. There's a couple of questions in the box around mental health. And this is something obviously you've spent a lot of time thinking about. about the impact of COVID on mental health and our well-being in that regard. Somebody asked in the question box around mental health for students in particular, and whether we're seeing things like an uptick in eating disorders and others. Just wondered if you could talk generally about what mental health issues we're seeing around not only the disease itself, but around some of the isolation and other aspects of dealing with this.
You know, there are many stresses that we have all faced during the COVID-19 pandemic. It could be someone's own health, or it could be the health of a loved one. For a child, it might be the health of a parent or a grandparent, potentially someone passed away. It has also been the result of the isolation that you spoke about, and you know, trying to do remote school and not having as much interaction with peers, etc. So many different stressors. It could have been economic stresses or you know, housing stresses. It could be the mental health of an adult that has influenced a child or a teenager. So many different issues. We are seeing more mental health issues during the pandemic. We are seeing more depression and anxiety. And we are actually seeing, I've heard from my colleagues in the eating disorder field, we are seeing more young people and young adults presenting with eating disorders. For example, anorexia nervosa, bulimia nervosa in binge eating disorders. The previous clinic that I ran at Penn State Health and the Penn State College of Medicine is busier than ever, and have had to you know, adapt to telehealth, et cetera, but have been really inundated with patients. So we are seeing those mental health issues, and we're going to need to work at HHS and working with our state and local partners on addressing that.
I know when you were in Pennsylvania, you made tackling the addiction crisis a cornerstone of your work, particularly around the opioid crisis in Pennsylvania. Are we seeing anything related to the addiction crisis, related to the pandemic? Has that been an area where we're starting to pay a little attention to what's been happening?
Mm-hmm. It absolutely is. And thank you for that question. So you're right. The opioid substance use disorder crisis, overdose crisis is something that I focused on in my time as the physician general and then the Secretary of Health of Pennsylvania. And we are facing an overdose crisis that has worsened. You know, we had made some progress before the pandemic, but I'm sorry to report that things have actually worsened during the COVID-19 pandemic. The data from the CDC indicates that in 2020, approximately 93,000 people in the United States died of drug overdoses. 93,000. That's the highest number of overdose deaths ever reported in a 12-month period since we've been doing that data, really in the history of our nation. So it has accelerated, and it underlines the need to address this from all different aspects. And so we have a specific overdose task force and subcommittee as part of our Behavioral Health Coordinating Council. And we've actually met and are going through, we need to address this, going through things from all aspects. And that includes prevention. Prevention includes working with young people in schools and in other settings, working with communities on prevention. And what I have focused on is working on what I like to call as opioid stewardship, which is working with the medical community to prescribe opioid pain medications very carefully and judiciously. Opioid stewardship. And so the CDC is working on adapting their prescribing guidelines, and we're going to be working on all aspects of opioid stewardship. The second is harm reduction, and there are several aspects of harm reduction. One is the continued distribution of the life-saving medicine naloxone, or Narcan. This was something I did in Pennsylvania, where I signed the first standing order prescription in Pennsylvania that anybody could go to a pharmacy and get Narcan so that they could carry it, and first responders had access to naloxone, for instance, police and fire departments and EMS. We need to work on furthering that throughout the country. In addition, we need to work on expanding access to what are called fentanyl strips. The drug that is leading to most of the overdose deaths in the United States are synthetic fentanyl compounds. that are brought into the United States through the cartels in Central and South America. So we need fentanyl strips so that people can detect that in a drug that they might be taking, as well as syringe service programs, which are evidence-based ways to help people suffering from the disease of addiction, help them in terms of overdoses, as well as preventing infectious diseases such as HIV and hepatitis. And then the last two are treatment, expanding access to treatment, including telehealth, as we mentioned, particularly medication for opioid use disorder. That includes buprenorphine medications, methadone, and a medication called long-acting naltrexone, also known as Vivitrol, as well as other forms of treatment. And then leading to recovery and expanding recovery efforts. So we're going to do that really closely with SAMHSA, with the Office of Drug Control Policy through the White House of National Drug Control Policy, and in our Behavioral Health Council. And we're going to work with our local and state colleagues on expanding all of these efforts.
That's great. We have a few questions from students, and so I want to get to them. So I'm going to raise a few of them now. Someone asked in the chat, if the trend of vaccination hesitancy within US adults continues, should the US become much more aggressive in distributing vaccines to other countries?
Well, we need to balance both. We need to balance the vaccination efforts in the United States, but we also need to work to the best of our ability to supply other nations, particularly disadvantaged nations, with vaccine as well. And I believe that we're now at approximately 100 million doses of vaccines have been distributed from the United States to other countries. And that is a fantastic effort, and we've made so much progress, but we will need to continue this, and we'll need to do more. In addition, we need to make sure that we have the vaccinations that are available in the United States. We want to work past vaccine hesitancy and make sure that we have the vaccines that are available and accessible to people as they get the knowledge that they need to make the right decision, which is the decision to be vaccinated. So we have two critically important efforts, and we need to do both at the same time.
Great. Another commenter asked, the pandemic certainly highlights the significant social needs and disparities in certain populations that impact health and well-being. Can you share your thoughts or HHS strategies on how we can do better to integrate social needs into healthcare delivery? And she also asked if we think certain payment models are better equipped to address social determinants of health.
Well,
you might want to say what social determinants of health are for
Sure.
those who are not following the question also.
Absolutely. So the social determinants of health, and I've alluded to this, are those aspects that influence people's health that we don't usually think of as health related. We usually think of health in terms of medical issues, seeing your doctor at the doctor's office, or maybe going to the community health center, the hospitals, medical treatment, and of course the reimbursement for that. So whether that is Medicare or Medicaid, or CHIP, the Children's Health Insurance Program, or commercial insurance, or the exchanges through the Affordable Care Act. That's what we tend to think of. We might think of public health in terms of some of the things we've been talking about. But there are so many other social issues that influence someone's health. And so that includes, we've mentioned transportation, access to transportation. That includes housing. It's virtually impossible to have good health if you're homeless. It makes it so much more challenging if you're homeless. And so appropriate and affordable housing is, to me, a health issue. Educational opportunity is a health issue. I think that really economic opportunity and a living wage are health issues, because we know that one of the worst things that can impact your health is the influence of poverty. So many other issues, nutrition, the environment, all those to me are health issues. And so there is a term called health in all policies, so that health is really involved in all policies. And I think that all of these different issues are so critical to our recovery from COVID-19 and our resilience as a nation as we work through and then past COVID-19. So we want to work at HHS with all of our colleagues across the administration with HUD, with the Department of Transportation, with the Department of Education, with the Treasury Department and the Department of Commerce, all of those different issues, with environmental protection and the Department of the Interior. So all of those things. There are other social issues that have impacted health so much, and really that includes racism. Systemic racism in our country has negatively impacted health in so many ways, particularly for racial and ethnic minorities, such as the African American community, the Latinx community, and as well as American Indian and Native American communities. So, as part of our efforts, we have to we have to understand and accept that systemic racism has occurred and occurs, and then we have to address that head on. And that is obviously a key issue for the Secretary and the Department of Health and Human Services.
Thank you. Another questioner raised a point relating to your comment that these are public health and medical issues, not political issues. But of course, we live in a world where these issues have become politicized. And so the questioner asks, what can the medical community do to address this? Is there more that individuals who are part of the medical or public health community can do to sort of counter some of the politicization that we've seen around this?
Absolutely. I think it is the responsibility. It's not of the public health community and the medical community to address the politicalization of our medical and public health measures. And I think that people can do this both from a media point of view, potentially from a social media point of view. But again, I think that a lot of this is going to be local. I think that a lot of this is going to be trusted local community members, trusted local physicians, nurses, nurse practitioners, hospital administrators, and hospital personnel, talking to their communities about the safety of our vaccines, about the effectiveness of the vaccines, and about the importance of the vaccines, especially in light of the Delta variant, as well as really the other public health issues that we're addressing during COVID-19.
We've been talking a lot today about the Delta variant, and you alluded to the sort of evolving guidance as we learn more about the science and things change. I wonder if you could just say what do you think we have in store for us the next few months, and what can we expect? I know people are asking questions about whether we should expect another shutdown of sorts. Should we expect the virus to further mutate into another variant? If you could just kind of give us all a little bit of window, if you could use your crystal ball and tell us what we have to look forward to this fall.
Well, it's a very challenging thing to do. And public health officials, we have to be very cautious about using the proverbial crystal ball because it depends. It depends on what people do. And it depends on how conditions on the ground could change. So, I think much of what's going to happen over the next number of months in the United States and globally is whether people work through their questions about the vaccines and get vaccinated. Now, we are seeing some increases over the last number of weeks in our vaccination rates throughout the United States, as well as particularly in counties and states that have had low vaccination rates. That's a really good sign. And it's absolutely necessary, but it's still not sufficient. We need more and more people to understand the safety and the effectiveness of the vaccines, to understand their importance now, especially with the Delta variant, to answer whatever questions they have, roll up their sleeves and get vaccinated. And if we have a surge of people getting vaccinated, then I think things will look much more positive as we complete the summer and into the fall. I think that if people do not do that, and we continue to have low vaccination rates in many areas and states in the country, then I think it's going to be more challenging. I think that we're going to see the Delta variant continue to spread among unvaccinated people. We have some new data from the CDC last week that although it is extremely unusual for someone to be vaccinated and to get very sick or to need to be hospitalized, it is possible to have a breakthrough, and then that person is contagious. So that is new new data, although the numbers are still very, very low compared to the number of people who are vaccinated. So it really is, the key is going to be what unvaccinated people do and what those communities do. I think that if people really do, we see a real surge in vaccinations, the future is looking much brighter for the end of the summer and then the fall and the winter. If people do not, then I think we're in for a very challenging time as the Delta variant continues to spread. We also need to continue our global efforts as well. I can't tell you, I mean, mutations happen and variants develop. There's no way I can tell you whether we'll have another challenging variant, so we'll see. The one way to decrease the amount of variants we see is for more people throughout the United States and the world to get vaccinated. And that's actually what we can do to decrease the development of these new mutations and these new variants.
Thank you. You know, we probably have time for another question or two, so I'd encourage folks to raise it in their chat now if you have additional questions. But one thing I'm struck by, even just reading some of the questions that I've read you today, is like you're speaking to an audience of students and alumni who are public service motivated. They are affiliated with the Sine Institute. They are thinking about careers in public service. And so I wonder if there's anything you would say to them today as somebody who's had such a distinguished career on the state and federal level in public service about lessons from this experience that you've drawn and that you hold dear that might inform them as they go out and embark upon their careers.
You know, what I always felt so was so rewarding about my previous career in academic medicine was that all I really did was try to help people. You know, I would see patients and children and teens and their families and try to help them. I would teach students and resident staff, et cetera, and then give other lectures about how to help people. We would do clinical research about how to help people better, and then develop those programs in administration about how to do all that, you know, how to teach better, how to develop new programs for eating disorders and things like that. When I had the opportunity to go into public service, my goal was to do that and to help people with a broader brush, from a broader public health perspective. And I truly feel gratified that I feel that in my role as the Physician General and the Secretary of Health in Pennsylvania, and now as the Assistant Secretary for Health nationally, that I am doing that. I'm trying to help people now with the brush of the entire nation. And so I think that all of you, the students and the alumni, as you go through, you know, your fields, and there's so many different interests that people might have. So whether that is, you know, medicine or public health, or maybe it's the law, or maybe it's economics, or maybe it's, you know, social services, and, you know, there's countless different fields that people go into. I think it's important to find what your niche is, what your passion is, and then use that to serve the common good and to help people. And there are so many different ways to do that. Maybe it's actually in the arts and the humanities. Maybe it's through literature or dance or through music or through poetry. There's so many different ways to do that, but find what your passion is and then use that for the common good.
I'm tempted to end on that note, but we have a couple more questions in the chat, but that was great. So one commenter in the chat just raised the question, at this point, how extensive and established, and you've alluded to this, do you think telemedicine is going to be post-COVID? Do you think when we get out of the public health emergency, the forces may say, hey, let's kind of go back to doing things the way we were, or do you think we're going to be able to sort of firmly cement this?
I think we're going to firmly cement telehealth into the fabric of medical care in our nation. I think that we have seen how effective it can be. We want to learn to do it better. We also have to deal with the health equity component. Not everybody has broadband. Not everybody has computers like we're on now as we're doing this teleconference. Not everybody might even have cell phones. I mean, we're going to need to be able to work through the health equity component of this to make sure that everybody has an even playing field in terms of access to telehealth. So I think that there are so many challenges, but I think that telehealth is now firmly implanted into the fabric of medicine in our nation and will continue. And I think we're going to learn to do it better. The president says, build back better.
And here's a question I missed earlier. One of the commenters asked, with the probable increase in adverse childhood experiences that children have had since they've been living at home, so whether it's witnessing or experiencing domestic violence or some other trauma, do you think that pediatricians should be implementing trauma screens as part of well visits?
I think that we should look at that. I think that when you think of adverse childhood experiences and ACEs, I mean, COVID-19 has been, really, I think it's going to end up being a generational trauma for young people, because it has impacted everyone to such an extent. And then we've talked about the health equity component with others, more than some communities. So I think that we're gonna need to address that. I think that doing screening is one way to do that. I think that we should study that and study how that might be implemented in primary care settings and community clinic settings. So I think it's a great idea and we should look at it.
Excellent. And I think our last question here is I think a good one to end on, is sort of what surprised you? What are some of the biggest surprises that you have encountered, during this period of grappling with the pandemic?
Well, several things. We had been preparing for a pandemic. I mean, I always said, as the Secretary of Health of Pennsylvania, that we had certain priorities. The opioid crisis and overdoses was one. Others varied from year to year, but included maternal mortality. It included health equity. It included environmental health. But the other that was steady was public health preparedness in case there was a pandemic. But I think the size and scope of COVID-19 is more than anybody in public health throughout the world anticipated. I think the ability of COVID-19 to develop these variants and to spread as it has, particularly now the most challenging Delta variant, has been surprising. Not all viruses will mutate and develop variants like that, and so I think that has been challenging. I think that what hasn't surprised me is that we're all interconnected. What happens to one of us affects our family. It affects our friends and our community. It affects our states and our nation, and it impacts the world. That does not come as a surprise to me. And so I think that we need to use what we've learned. And again, as the president has said, build back better. We need to continue to work through our recovery from COVID-19 and then work on resilience for our nation and the world. Now, I am a positive and optimistic person, and I think that we can and we will work together as a nation and as a global community for the benefit of everyone as we get past COVID-19.
That's a great point to end on. I will say, Dr. Levine, several commenters have noted throughout that they've had a chance to listen to you before, and that, as always, your brilliance and your compassion shines through. But one commenter said, "We owe you a debt of gratitude," and I agree with that. And so we thank you for joining us today, and more importantly, we thank you for your service. I think I probably speak for many of us. I think we probably feel a little bit better about our leadership and how our leadership is tackling this crisis with people like you there. So thank you for being here with us today at Sine.
Thank you so much.
Take care, everyone.